If you ask me the question, and do we feel like things are changing from people believing this is a moral failure to believing it's a chronic disease? And I'm like, this executive order is a huge example of that, because the executive order says that we must treat addiction like other chronic diseases.
Hello and welcome to the Dr. Suzette Glasner podcast. Today, I am in Washington, D.C. at the Department of Health and Human Services, where I have the pleasure of being joined by Kathryn Burgum, Senior Advisor to the White House on Addiction Recovery and co-chair of the Great American Recovery Initiative, which was initiated by executive order in January of 2026. with the goals of expanding access to addiction care and reducing the stigma surrounding addiction to very important causes that we commonly strive towards. Kathryn previously served as First Lady of North Dakota from 2016 to 2025 alongside her husband, now Interior Secretary Doug Burgum. Kathryn brings more than 2 decades of personal experience in recovery from alcohol use disorder to the work that she does here at the Department of Health and Human Services, experience that has shaped her advocacy from the state level to now federal policy today. Kathryn Burgum, thank you so much for being here.
Well, thank you so much for having me. I'm so excited to have this conversation with you.
Likewise, we have so much to talk about. I thought I would actually open with something that you have said publicly and dig into a little bit of what's behind it, because I think it's very important. You said, if not for the grace of God, I would not be here today. And my question is, when and how did you find God in your addiction and recovery journey?
Wow. Well, hey, I think God was always there. But so I struggled for, over 20 years, basically started drinking in high school, blackout drinker. So more than 20 years, struggled a long time. And at that part of my life didn't have a lot of faith. Grew up Catholic, had some not so good experiences with Catholicism growing up. And so really kind of was living my life without a lot of faith. I went into a period of relapse about 8 years consistently. I'd get a year and I'd go back out. I'd get 6 months, I'd go back out. It was very consistent, and I was, I have an MBA. I was a pretty high achiever. I could set any goal for myself, but I couldn't stop drinking. And I didn't really understand why. And so at the end of my drinking, I was suicidal. I had untreated depression, but, you just become very hopeless, and so I was out walking one day, and there was a voice in my head that said, "Maybe you should ask for help." I always get emotional when I talk about it, because huge moment, in my life. And so I thought, what could it hurt? So I just said, I don't know if anyone's out there, but I need help. And I have been sober since I said those words over 24 years ago. So that was so powerful for me. And, and it was kind of like, wow, if that's all it would have taken, but I also believe that, addiction is a very difficult and challenging, chronic, lifelong, relapsing brain disease. There is a component of it where you have to look beyond yourself. You have to rely on something other than yourself, because I know for me, I couldn't MBA my way out of addiction. I couldn't rely on myself. I needed to have, and so God is a huge part of my story and a huge part of my life now.
Wow. Okay. I have so many questions. I'll start with, and thank you for sharing that. That is so deeply personal. And the way that you are sort of spreading this knowledge and spreading your story, I think is likely very relatable to a lot of people. And a lot of people who felt the kind of despair that you did before you entered recovery and couldn't see that there could possibly be an other side of this, a different kind of life that they could initiate and live. And you're living proof that it is right there on the other side. Not that it's easy, but I'm really, really touched that you're sharing this depth of your story. And that's something we'll talk a little bit more about what it's like to do that, and what it's been like in the different roles and phases of your life. But a couple of the questions that came to mind for me as you were telling your story of that moment, well, the first one was that God speaking to you in that moment?
I'm pretty sure it was. Yes, absolutely.
And had that happened before?
No, had not.
Do you know why God appeared then?
I think that's God. I think that's the way it works. I think that, I think all it takes is really to ask for God to come into your life. I didn't really understand that. I used to say to people, I don't understand, that how you believe and why you believed. I was a little bit of a doubting Thomas. If I can't see it, can't be real. And, like if you get just like struck down, like how does it work? And it literally is just ask for help. And I firmly believe that is what happens for a lot of people. And the power of prayer is so significant.
Yeah. I think the power of prayer is very significant, but I also think that you're not alone in that experience that you had early on where you had some negative associations with religion and with formal religion. I think a lot of people go through that in one form or another. Either they personally rejected in childhood or in their early years because they feel like it's pushed too much, or there's something about it that doesn't feel right, or sometimes in the context of religious setting, unfortunate things happen that shape those experiences. So for various reasons, I think it's not that uncommon that people go through that. How did you was it that moment that you felt like God was speaking to you that helped you find your way back to faith? Because that can be kind of hard.
Right. Yeah. I talk about it now and I get so overwhelmed with gratitude. But at that moment, I didn't know, because I didn't have a lot of sobriety. I didn't, but I knew that I was so done with living the life that I had. So the next thought was, you need to be with people that understand this. You need to find people that have the same experience, and I was like, people had told me that, but I was like, I'm not the same as those people. But that's what I did. I did go find people that were just like me, that struggled with addiction, that, that had found sobriety and recovery, and they were doing really well in their lives. So I was like, I just was also completely willing to do like what anyone said to me at that point, because I, it's like I had these, when I would have these suicidal thoughts, God was intervening in my life, I believe, then too, because I was a blackout drinker. But when I was sober, that was not what I wanted for my life. I didn't have those thoughts. So I think that I really, I didn't know it at the time, but then I started to have more sobriety in my life. I started to understand that, that faith is something that, it became a part of my life because it was just part of the way I lived my life, and it was part of what I believed in, and I knew I needed to believe in something that wasn't me because I could not solve this problem. But really, it wasn't, it was, so I had faith and I prayed and everything, but, weirdly enough, maybe other people feel this way, but I watched the Chosen series and there was the doubting Thomas. Like, that's Jesus is Jesus. Like, wow. Like, it was all the stories I had read. It was and I said to someone, I'm like, wow, that was like the best marketing program ever for getting people to have faith and believe in God and believe in Jesus. But so that was a very powerful moment in my life too,
Yeah, it
but
sounds like it. Well,
yeah,
wrestling with the concept of God and a higher power,
yeah,
I think is part of finding spirituality.
exactly.
We
Yes.
don't all have to accept that God is there from day one.
Right.
But even engaging with that, wrestling with the concept and what does it mean and how does God show up for you in your life, and how is faith and spirituality tied to gratitude, because you talk about gratitude
Yes.
a fair amount as well. And it seems like that's part of what keeps you grounded in
Yes.
recognizing what's good in your life and how you want to elevate those things and how incompatible drinking is with that.
Right. Gratitude is just such a grounding thing in life. Like I spent a lot of time being a victim, of everything. And gratitude, it's hard to be grateful and be a victim at the same time.
This is true. This is
Yeah.
true.
And I just feel like there's a faith movement in our country right now.
It does feel like that.
I feel like there was a big void. And I think, I'm really grateful to see that, I'm grateful there's a faith office in the White House, because especially in this world of addiction, faith has to be a big part of the journey. I say that it has to be only because that's my experience. I think for other people, maybe not. There's a lot of paths to recovery and sobriety, but I'm just, and then I was as first lady out there, giving talks, and people would be like, you shouldn't talk about God, you shouldn't mention that. And so I didn't, I really didn't talk about that much until
Why, though? Why
until
shouldn't you
recently.
mention God?
Because it's that thing, this separation of it's a private thing, or maybe some of those people, I don't know, didn't have faith. I don't know. So, but now I'm just, very open about it because it is a big part of my experience and a big part of my life today.
Well, and it's interesting because the timing of you sort of elevating this point corresponds with a new research study that came out this past year. It was the first large study. It was a meta-analysis, so they were summarizing 55 other studies that included over 500,000 people. And they were looking at how spirituality and religious practices impact the risk of developing a substance use disorder. So this is a little bit of the other side of it. It's not that looking at the recovery aspect, but there was a 13% reduction in the risk of hazardous alcohol or other substance use related to engaging in some kind of regular spiritual practice. And that didn't have to be formal religious practice. It could be. It could be going to services, but it could be other things that connect a person with a sense of spirituality. So, I mean, if we think about that as a prevention tool for our young people,
Yes.
it's very powerful.
Yes, and I know that report. I was so excited. Such an exciting report.
This.
Yes.
Yeah.
I'm so glad you brought that up. Yes.
So, I mean, what you've experienced in your real life is borne out in research. It's always nice when those two things line up that way. So the other question that came to mind, though, was around the depression and the suicidal thoughts. What's your sense of the chicken and egg thing like for you in your life? What came first for you?
Well, definitely. So, I started drinking in high school, but, on the outside, it looked like I had it all together. I had a lot of friends. I had, lived, we didn't want for anything in terms of my family and my parents and the living they were making. And, I was on the honor society, I was in sports. But there were a lot of days I didn't want to get out of bed. and I didn't know why, like I was like, what is this? And my family's very Scandinavian. I'm basically Viking. And, there wasn't a lot of conversation about feelings and, whining about things. And so we never talked about it. And in school back then, there were counselors that could help you figure out what college to go to, but they didn't talk about anything, mental health wise. So for me, when I took that first drink, the negative thoughts I had in my head, which happened a lot also, went away. And I, probably had social anxiety, but yet I was, really pushed to be someone who was very social. And so I think, some of those things, all came together. But I took that first drink and I was like, this is nirvana. This is the answer. Until I had my first blackout. But, it wasn't enough for me to go, oh boy, that's not for me. Because for me, it was the solution. I was willing to put up with that because I didn't like, how I was feeling. I didn't like depression. I didn't like those things, but also didn't know that alcohol was a depressant, and that doesn't help things.
Well, you also are a high achiever, which can make it worse in the sense that the time to discovering that you have a problem, like things really have to fall apart for
That's
someone
correct.
who's a high achiever to be discovered sometimes as someone who's suffering with a problem. And this is a lot of what we're talking about when we say suffering in silence, is because you were not talking about feelings at home. You were kind of taught not to do that. So you were silently dealing with depression. And it sounds like maybe it predated the drinking.
Yes.
But then the drinking made it worse.
Oh, yeah. Yeah.
But then you couldn't stop drinking, it sounds like.
Right. No. Yeah. No. And that was pretty baffling to me. But I understand now why I couldn't stop drinking. So.
Does it run in your family?
Yes, for sure.
Okay, yeah. There's a strong genetic component to it. So, okay. And does it run in your family in ways that you observed it, or? Oh yeah.
Yeah. My family didn't do anything unless there was alcohol involved.
Oh, really?
Yeah. Yeah. It was a big part of it.
Well, what was it like getting sober then around your family?
Well, I got sober when I was older, I wasn't around them as much, in terms of events. But, when I turned that corner, it wasn't hard, still isn't hard for me to be at events where there's alcohol or whatever. My brain just doesn't work that way anymore.
That's interesting. Well, we think about recovery from alcohol and drug addiction as sort of similar in some ways, or sharing some parallels with recovery from other chronic illnesses like cancer.
Yeah.
And once you've passed 5 years or so, not that people don't relapse after having a long time in recovery. Right. It does happen.
Right. Because you did a podcast on someone who relapsed after 10 years. I was listening to that. Yes. Anyway, keep going.
No, you're right.
It happens.
It does happen.
Yes.
But the risk of it and the likelihood of it is way lower once you pass 5 years. So I think probably what you're experiencing in some of those settings where it's kind of like, it's not a thing for you anymore that you're kind of like actively tempted by.
Right. But I'm not cavalier about it either, because I do know I've had sponsors with 20 years of recovery that went out again and are still out, and are completely different people. I've had people like that. So yes.
That's sad. But it does happen. And so it's good that you have that mindset. Like, you're never fully past it, like in the sense of, no, you don't have to be worried actively about it and stressed about it all the time for the rest of your life, but you have to be vigilant.
Right.
You know that with the right or the wrong set of circumstances in your life at any given moment, too much stress, not enough sleep, I don't know, family stuff going on, too much work, depression creeping in, and there are all kinds of things that can make you vulnerable at any moment. So the fact that you know that,
I
is
have
good.
so many, and people that have, are like, I don't know. I was just at a party and someone passed a tray and I took a drink, but I do have to say, I travel a lot, and it used to be there were like little mini bars with tiny little, now there's a whole bar set up in the hotel, like big bar, and it's just like, wow. And there's only been a couple of times where I've called ahead and said, I don't want to have alcohol in my room, so just remove it all before I arrive. But I'm so used to it, now it's just not.
Well, why not do that every time? It's just not on your radar sometimes.
Yeah, no, I mean, I think, so, but anyway, but it's just interesting how that is like, anyway, but yeah. So.
Well, can you share a little bit about what because you mentioned people have different pathways to recovery, and you've mentioned a few things that made me think that maybe 12-step was part of your recovery, but could you take me through a little bit more around what ended up working for you?
Yeah, I mean, I think, there's a lot, as I said, there's a lot of paths to recovery. And I think, there's 12-step is definitely, people just go the faith route, whatever. I found people that I knew were sober, that I knew had gone to treatment, that I knew were living successful lives. And I wanted to be with them, and I wanted to learn how they did it. And that's really what happened. I still have those friends today. They're a huge part of my life. Yeah.
Oh, wow. And so they're they became sort of like mentors in a way, but also friends.
Yeah, for sure. Yeah.
Okay, and how did they do it?
Yeah.
What did you learn from them?
They would probably be considered peer support specialists now, right?
That's what it sounds like.
Where they help you get back on your feet. And I'm a huge proponent of that. And I would love to talk more about that, because that's a big part of Great American Recovery for us. But, that when you're with someone, so when I was struggling, I worked for a lot of companies that had EAP programs, and I tried to work through that one time, found a counselor or whatever. But there's so much shame and stigma related to addiction. I couldn't really talk about it. And I think also therapists don't really even know what to ask unless that's the world they live in.
That's true.
But I think about now how cool it would be, and it's definitely something that we are considering and planning to work on, to have EAP programs offer peer support specialists, and I know I'm getting a little bit off topic, but to be able to have someone that is struggling know that you've got one person to talk to or multiple people. And because also, peer support specialists are people with lived experience with addiction and mental health issues. They have been down that road. A lot of them have felony convictions. They have some type of criminal justice entanglement. It's hard for them to get jobs. I believe we legally discriminate against people with felonies in America. Mm-hmm. And then they end up in this cycle of not being able to get out of that. They can't get a job. They can't get a place to live. They can't get all the social determinants of health. So to be able to have peer support specialists spread across the country, like especially in rural communities where we're never going to have, North Dakota, 50% of it's rural, never going to have enough services to help people that need it. We can't get, like during the event today, someone's like, I think Dr. Oz, raise your hand if you're a psychiatrist, don't you want to move to rural wherever?
Yeah.
So to be able to have those people. So, I'm a firm believer in that we need to professionalize that opportunity, the peer support specialists, and we need to grow that group of people across the nation and have them be in corporations. I spoke to someone in a big corporation that hired a chaplain the other day. I'm guessing those people would be happy to hire a peer support specialist too, because they're thinking differently about how they're going to take care of their workforce.
Right.
Yeah.
Right. Well, and I can see where this corresponds really closely with some of the areas of emphasis of the Great American Recovery Initiative, which I'm thinking about expanding access. So you have to think of things that are potentially scalable, right?
Yes.
And so peer recovery support specialists are scalable because as we were discussing, there are so many people out there with addiction, and there are so many people with addiction who are in recovery and who are doing really well. Actually,
Yes,
that's what research
exactly.
shows as well. Even though in the media you see, the worst, most severe cases of addiction really elevated and highlighted, and that tends to convey a message that people don't recover from this. You're stuck in it forever, revolving door. But the reality is that 3 out of 4 people recover from addiction. So that the success rate is much higher than most people think. So with that many people actively in recovery out there in the world, why not leverage that and their knowledge of the illness to help people?
Absolutely. You talk about the reason why Great American Recovery became so important to me is because half of our nation are impacted by the disease of addiction. Half of the people in America, 113 million people, are impacted by someone else's addiction. And I think that's a low number because that doesn't count the barista who finds someone overdosed in the restroom where they're working. Now, it probably doesn't count the number of times someone revives someone who's overdosed multiple times in one day. So I think that's a low number. I mean, everywhere I go and every time I speak to there's no one who's not had someone that they know in some way. So, and that's a generational disease. And so when I talk to people, I say, if we don't do something now, your kids and their kids and their kids, and it could be way worse, so because it's generational and it's, experiences related, it's so to me, and this is a point in time. So, I was finished with First Lady and I thought, I'll take some time off of public life, I'll travel or I'll learn French finally,
No such luck.
But it kept coming back to me that this administration is very unique. It's like a unicorn point in time where the senior people in the administration directly impacted. JD's mom, like we were talking about, the president's brother died of alcoholism. He's been open about that. Yeah. Susie Wiles' dad was Pat Summerall, and he got sober at Hazelden Betty Ford. Then we have Bobby, my co-chair, Great American Recovery, in recovery for 40 years from heroin addiction. So I just thought, wow, we have all these people with a lot of, and then we've got Dr. Oz, who understands this world. And there's just so many people. So I just thought, so for me, I kept thinking, I sending messages to Bobby, you can change this, you can, because for me, it was all about, for years I've been saying addiction is a chronic disease. It's a chronic disease, but we're not treating it that way. It's so fractured. There's so many gaps. There's so many problems with it. It's not, I was on the board of Hazelden Betty Ford, so I understand the payment systems and, Medicaid and how, so I believed very strong it's a chronic disease. So, and then I researched it. I'm like, does it take a law change to, make this embed this completely in healthcare? And it doesn't. So I said to Bobby, you can do this. You can do this. He's like, I really want to do this. And then I realized it's, as First Lady of North Dakota, people said to me all the time, you should do this, and I was like, so I just decided, one day that, I would mention the idea, to Susie. And then the president decided to make it an executive order. So, that's how it came about. But mostly because people are in this administration are very passionate about this. It's kind of like, if you ask me the question, and do we feel like things are changing from people believing this is a moral failure to believing it's a chronic disease? And I'm like, this executive order is a huge example of that, because the executive order says that we must treat addiction like other chronic diseases. It says that specifically in the executive order. Addiction is a chronic disease, and so that more than anything, I also believe employers are very focused on this because, of those 50 million people, almost 50 million people that, self-disclose, that they are struggling with addiction. 70 to 80% of them are employed full
yes.
or part-time.
Exactly.
But that's, the Great American Recovery is all about, the biggest goal for me is embedding how we treat addiction completely in a closed loop in a medical system without stigma. I went to treatment in a healthcare system. It's actually the Mayo Clinic, which does really incredible it saves so many lives. They're so well known. Their reputation's incredible. But I just chose them kind of out of the blue. I was ready to go, and that's where I decided to go. And treatment was in the basement, on the edge of campus, sort of like, yeah, we do this, but we don't really want people, it's like, it wasn't like, I don't think it was stigma focused, but we need to have the addiction, the chronic disease of addiction wing very prevalent in our healthcare systems today. So anyway, that I'm sort of going on and on about but the Great American Recovery, it was definitely not on my radar, just like being First Lady of North Dakota wasn't on my radar. But then, there's someone in my life, someone named God looking out for me and telling me and, to where I should go and what I should do. And that's just what I keep doing. And, and that's my passion. So,
well, it's working for you. You're in recovery 24 years. Now you're transforming those experiences that you had into real human impact, which you're very passionate about. And yeah, so was Bobby the one who approached you and said, will you be my co-chair? How did that all come to be?
That just came up in the executive order. So I did not know, it was that I was going to be, that it was going to be an executive order, that I was going to be a part of it until really a couple of days before. So,
wow. So what was your reaction to that? Were you excited?
Were you
scared?
I was so happy. Because I was so happy because it had the word chronic disease in it. Mm-hmm. And then it was a all of government approach, because housing, HUD, labor, employees, like it is education, medical schools, every, Indian Affairs, Indian Health, every department has a part to play. Every cabinet has a part to play in what we can do to help people in America, families and communities, they're impacted by this. So I was so happy. I didn't really understand what it would mean. And so that has been a very interesting process. And there's a lot of people in government, federal government, that really deeply care about how people receive treatment and how we approach people and how we, create opportunities, and so that's just been really an eye opener for me. I kind of knew that from North Dakota too, because our behavioral health team in North Dakota is still one of the best ever. Wow. But anyway, so there's a lot of people working hard on this executive order to make sure it's successful. Because it's the president that wants us to do this. It's his leadership. It's President Trump's leadership on this. That is the most important thing. Otherwise, this would not be happening. This transformation that's going to happen related to the chronic disease of addiction, we're also looking at how do we fill in some of the gaps. One of the biggest areas that would help is, we've already talked about, is peer support, making more professionalizing that. One of the other gaps is sober living. These are evidence-based. These are things that are proven to help people that are getting back on their feet in recovery. So those are two areas we're also looking at. And then we're also lifting up what's working across America. Those companies and places that are doing really good work, they're innovative, some of them are treatment centers that, that will basically let you come back for free for if you so basically it's sort of like they want to make sure that someone actually gets sober, finds recovery, and is very successful at it, and they're kind of going to guarantee that, and that's outcome based, right?
Yeah, so holding themselves accountable for outcomes.
Right.
So fees tied to outcomes.
And what we know is that 30 days does not work. The whole system has to change. So it was great today that, the pledge and the payers are here and the healthcare systems and the associations, everybody's coming together saying, we've got to have clinical pathways. And this is very important. And I think getting everybody here today helps them start thinking about what's the part that we play in this? How do we need to change what we're doing? And it's just such an important event today.
Yeah. It was a special experience to be a part of that and to be part of making a pledge to improve the quality of behavioral health care and addiction care. Something that the field really needs because there's so much variability in what people actually do and practice out there.
Yes.
And there are some organizations like Shatterproof that have really worked on defining what quality care means, what kind of standards, you hold a program to say this is high quality and this is evidence-based, because the treatment landscape out there is very confusing for the average person. They have a substance use disorder crisis come up. And I mean, this is partly why I wrote the two books that I wrote. Yeah. One being a recovery skills workbook and one just a general educational kind of book around addiction and what it is and how it's treated, because this is so confusing for so many people. Yeah. There are so many different forms of care. There's inpatient, there's residential, there's outpatient, there's intensive outpatient, there's, medication, there's psychotherapy, there's peer support. So what do you do when you're having a substance use disorder crisis? Do you go straight for inpatient? I think this is where, as you mentioned, employers start to see the cost of care for them associated with addiction looking sky high because people are going to out of network, inpatient settings.
Crisis level.
When the research studies actually show that most people can be treated on an outpatient basis effectively. Not everybody. There are some people who need medical detoxification to safely stop taking a certain substance, particularly alcohol. Did you ever have to go through a
medical
detoxification?
No.
Okay. Okay. So what you're doing as far as sort of like figuring out where the gaps are in the system and how to fill them, that it's a huge job though.
It's a whole systemic change. I mean, really you should start with primary care, family practice doctor, because they're the ones that will see it, that can see it, but they don't know what to ask. I think there's only 2 questions on the medical boards about addiction. So it's not a priority. I know there's a degree in addiction medicine, but we have to start with that, right? If we call it, here's the other thing that's going on that I'm like, how are we going to resolve this? So addiction to chronic brain disease. Is it also a substance use disorder? Is it like a disorder? I don't think we can do those 2 things. I think it's a disease and we have to call it a disease. I don't think we can keep calling this a substance use disorder because it's confusing, So also a disease, it's hard to have a lot of stigma around a disease. I think disorder can have a lot more stigma. Disorders like, all that mental health,
Oh, that's interesting.
So I think we have to come to some kind of agreement that everyone's going to pledge to call this a chronic brain disease. It's a chronic relapsing brain disease, just like diabetes. Any way you look at it, that is what, we don't fail people in diabetes if they don't do it right in 30 days.
Right.
But we do that for, you get one shot at treatment. It's only 30 days because that's how the system works. That's dictating the treatment people need. So it is a systemic change, but I'm not sure we can do substance use disorder and chronic disease at the same time.
Well, the thing that comes to mind for me though is it the name, or is it the concept of sort of like volition in it? Because we call other diseases disorders too. Like we refer to metabolic disorders, endocrine disorders. I'm trying to think what else has kidney disorders, and we don't see stigma attached to those things. No. So I don't know how much of it is carried by the word disorder alone. Maybe that's not helping.
No. Mm-hmm.
But I think there's something around, and you hit on part of it. The stigma that people experience around addiction is not just from their neighbor or their peer. Mm-hmm. It's also in the medical and the healthcare system. So it's in the way that they're treated when they go to an ER. Mm-hmm. Like, it's an addict here again. Mm-hmm. They need to go to the bottom of the priority list because there's someone with a real problem. Right. So, I mean, I've heard about this from patients I've treated, people who are hesitant to go into certain healthcare settings because they're afraid that they're going to be judged and stigmatized. And there have been some secret shopper studies, people going into pain clinics, for example. If they have a history of addiction, the doctors don't want to see them because, they're going to be seeking opioids, and that's just a drag on their, on their practice. So it shows up in a lot of different ways. So I think what you're talking about as far as education in the medical community is a really important part of that, because it's that kind of experience that discourages people from seeking help.
Right. Just like medical schools are not going to be talking about nutrition, they're also going to need to start talking about addiction, the chronic disease of addiction, and training people, so that they can recognize it. So you can have an open conversation when your doctor, like I never would have, because of the shame and stigma, I never would have spoken to my doctor. But if America, because what we're planning to do through the Great American Recovery is enlist partners and coalitions to help provide education about the disease of addiction to America so that they understand it. But, I think it's also very possible for people to understand it's a disease, but yet still be so angry at their family members. And they're so angry, probably because they've stolen from, or their criminal justice, and they keep going in and out. How frustrating that would be, and so I don't know that the disease, necessarily makes that go away, but I think it helps us move much closer to what people understand about diseases. And it really is, the stigma runs deep. I did a search on AI, and I was like, when was it first identified? When was stigma first identified related to addiction? And it said in 2000 BC, it was written about public intoxication. And I was like, okay, HIV this is like what happened with HIV. Great American Recovery is like HIV, I don't know, 50 years maybe. We've got thousands of years of stigma to overcome. And, it's a big lift. It's because there just are a lot of people who don't, people homeless, the people just, they will never accept, unless they really understand or they know someone who is, affected by this. But so this is a big lift for us it's a transformation that'll need to happen across America, and also in the medical systems and healthcare. Definitely, we have to change it there. We need a fully, a system that, is fully wrapped around the chronic disease of addiction, because it's the handoffs that are the problems. Someone comes to the ER and they're overdosed. They revive them, and then they're like, here's a brochure. Maybe you should think about this. Where in this system, it should be that They may not even go to the ER. They go to the chronic disease wing. They don't have to, things would change significantly. I think payers, may be worried about how is this going to work, but you don't have to, we're not going to be treating this at the crisis level. We're going to get started sooner than that, or it's going to be like having a heart attack. Go to the ER. Maybe you do, I guess. In some places, you might be able to go directly into the hospital, So changing how we approach this and how we treat it will be a big part of the Great American Recovery.
In the time that you have in this role, if you fast forward till your term is ending, not that you want to think about that now because you really sound like you're just getting started.
Right.
But are there a few tangible things that you could point to that would be different? I mean, you've been talking about a lot of them, but there are so many. It is a fragmented system and you're tackling a lot. So if you had to look at, I don't know, if you had to point out 2 or 3 things that you wanted to change and what it would look like on the other side of the Great American Recovery Initiative, so you could point to it and say, this changed, this moved, what would that look like?
Well, it would be really back to the chronic disease of addiction. What we do now is we get involved at the crisis level, and then we layer and layer and layer and layer things to try to help at that level, that are very expensive, what would happen is I'm meeting with my primary care doc. The doctor and I have this conversation, and they, as a protocol, as a clinical pathway, he says, I think maybe you should consider outpatient treatment or whatever. They have that conversation. That conversation just doesn't happen now. We get involved much sooner. We are in the medical world. There's doctors are better understanding this because it's part of what they're taught. It's part of their rotation. And then if things, I think a lot of things will go away if we are able to start much earlier and work with people much sooner, and we don't have to get involved at the crisis level. I think things would change very significantly.
So you're thinking people being screened and monitored for the way that they're using their substance involvement, rather than waiting for a crisis to unfold unbeknownst to anybody. So
I mean, my experience was I knew I had a problem for years, but it really wasn't until my life was completely falling apart, that I was really willing to reach out for help, go to treatment, it's the stigma just prevents people from talking about it. You should, when I go into a walk-in clinic for, a cold or something, the first question they ask me is, do you feel safe at home? That's an interesting question that is, is obviously part of the protocol. And that's kind of an awkward thing to bring up in so, it feels like there should be, because if someone says I'm not sleeping, I'm a lot of anxiety, there's a lot of signs that could be, and having that conversation about, are you, do you smoke pot? How many drinks do you have a week? Sometimes they'll ask that, I think, or they'll ask it on the, the form that you fill out. But I just think it'll be much easier to have those conversations if we have the medical world better understanding this is a chronic disease, and they have to actually know about it, like on the boards, and then and then they're trained to ask those questions when they work with anyone right away.
Right. Okay. So medical education.
Yes.
Fast forward to Great American Recovery Initiative has been going on for years, and you're summarizing your achievements. And one is that addiction is now on the medical board's exam in a beyond superficial way. They have to have a depth of understanding about it. Medical professions outside of the specialty of addiction and behavioral health will be involved in helping people identify and navigate to the right place in terms of care.
Right. Navigation is one of the first things. People don't know where to go, what to do. Yes, it'll be just like if your doctor identifies, oh, you might be pre-diabetes, here's what's going to happen. And you're in that system the rest of your life if you need to be. And that's the same way, it'll be with addiction. And when you say years and years down the road, so I have 3 doctors working on identifying the codes, identifying the highest priority. What can we do that doesn't need a law change? One of the biggest things that I'm hoping also comes out of this is that the IMD 16-bed exclusion goes away. That's a law change.
Talk about that.
Hasn't been changed. Well, it came about as a result of the Social Security Act in 1972. And it had to do with, back then there were big institutions where people who had mental health issues would be parked for the rest of their life. And that law came about so that that would not happen anymore. So any institution that had more than 16 beds cannot receive reimbursement for Medicaid. But it's a big problem because treatment didn't include treatment, but yet it applies to treatment. In rural America, there's a lot of hospitals, hardly used. They have a lot of beds. They could be doing treatment. There's just a lot of the capacity is such an issue, but you have these locations that have capacity that can't, that they won't take. And 40% of the people that struggle with addiction are on Medicaid, so that changing that, but of course there's a cost. But, as we look at this model, changing this disease model, it's really a shifting of cost, it's shifting from the ER, the high expensive ER visits to providing more treatment versus
that's the thing. It's not just a shifting, but it's a reduction, I would think.
Exactly.
Because that you're talking about the cost of untreated substance use disorder.
Right? I am. But immediately the criminal justice costs go down, social services costs go down.
Once you treat it.
Healthcare. I mean, it is the economic bonus of people getting back to work, all the drag on the economy. It's like that's one of the biggest things that, to me, the ROI for this, it's not just about, caring about people and, helping people. There's a huge benefit. Gosh, I'm sorry. This is what happens to me. This is like, I'm so passionate about it, but I'm also, there's just so many people that need help.
Are you thinking of anyone in particular when you say that? Or
sorry. Okay. I think about the people that I know, that had recovery, were doing well with their life. And then, they're not here any longer because, they don't have a check-in system. They don't do their annual checkup, or they don't, that's might normally be a part of the healthcare system, or they don't reach out for help because of the stigma. I had recovery and now I don't, and I'm deeply ashamed, and they die, and so it's those. I just think, we have such opportunity to, 190 million people is a lot of people impacted by addiction. So the ROI is huge, but also, so I think, because I think that's the biggest reason why, like, the 16-bed thing hasn't been changed. It's just, it's expensive, $10 billion over 10 years or something, but that just seems like a drop in the bucket compared to other things. But yet when we work with payers, or we're working this out through CMS, it's about how can we shift this? How can we do this? How can we be innovative so that it's not about more taxpayer dollars?
One question I had for you when we're talking about innovation in care and expanding access to care, because I work in digital health, was around whether there's been any thought around how digital health treatment and or AI based treatments. I know that came up this morning in the meeting as well. Is part of the thinking around the Great American Recovery Initiative, and if so, how? Just as sort of a mechanism for achieving this scaling and increase in accessibility.
Yeah. I have to tell you, I am all for AI because I see the productivity increases, the efficiency. I'm not a wizard. I don't know how to do bots and whatever, but I use it, every day. And it's really, I learn so much. It's such a great learning tool. I don't know how it came up in the conversation today. I missed that part, but
Dr. Oz was talking about how AI is transforming efficiency in diagnosis, for example. Instead of reading through a 400-page record to try and figure out what's wrong with someone, you can leverage AI to get an answer more quickly and initiate treatment, that kind of thing. And then another thing that didn't come up, but that's been on my mind, is around using chatbots to deliver some elements of care for people with addiction and mental health disorders who need support but can't access a specialist, a therapist. So yeah, I mean, there are a lot of different ways that it could really impact that sort of gap between treatment need and receipt of services.
Right. Yeah. No, we haven't spent a lot of time on it, but I think that I am in favor because I think there's a lot of opportunity. Like, the quicker we can make decisions, the sooner we can reach people, the sooner we can identify they need help. And that's what it is. It's an efficiency tool. It's a productivity tool. So I'm all in favor of that. All the research I did was calling, ChatGPT or AI my coworker, because I learned, like I said, I learned so much. I'm not trying to, and I want to learn more about how to use it to be, help me be more efficient. But I think there's probably a lot of ways that it could be used in the treatment and recovery world to help, to help more people.
Yeah. I mean, that would be the goal. And so it sounds like it doesn't have like a specific like place in the plan of the Great American Recovery Initiative, but it's something that's on the radar as it's evolving, and there's a positive sentiment towards it.
No, you're giving me you're making me think this does need to be part of it. So yes, absolutely. And we're making a lot of progress. But this is one of the things where I keep saying you can, shoot an arrow in any direction. There's a lot of opportunity.
Right. Yeah. And it sounds like I'm getting like a good feel for your priorities. So, I mean, that was sort of one of my questions, like definitely sort of destigmatizing addiction, helping the world really, and America see addiction as the chronic illness that it is, and that it does, by the way. I mean, you're completely right. It bears out in research. We have neuroimaging research, decades worth, that shows the way that chronic substance use alters the brain and the very functions that the brain would really need in order to make decisions that would alter the course of one's life for the positive. So those decision-making capabilities become impaired. And that's what you're seeing at play when a person is making what we would judgmentally call the wrong choice over and over again, but that choice mechanism in the brain just isn't functioning the way that it's supposed to. And we also see when you look at patterns of remission and relapse and recovery for other chronic diseases like diabetes and heart disease, addiction's right there on par with them. It behaves as a disease very similarly to other chronic diseases. And if you think about what would happen if you took away someone's insulin for their diabetes? What would happen if you took away their antihypertensives if they had high blood pressure? They would have a relapse of their symptoms. And we have the same situation with addiction care. Not that a person needs to be in the same level of intensive care over the course of a lifetime, but some form of treatment and support, which is what I think you're taking a lens to with your emphasis on the peer recovery specialist role, is important for people to maintain that vigilance that you have in order to prevent relapse down the line. So, so these priorities that you're describing are pretty well aligned with addiction science.
I'm going to have to hire you to be a spokesperson, I think, because the way you just described it, comparing it to diabetes, like, it was in 1957, it was declared a disease by the American Medical Association, but then it was placed into psychiatry, not in medicine. Think of how different it might be today if it was actually, it's a DSM-5, but yet American Medical Association, American Addiction Medicine, Society of Addiction Medicine, like all these very respected associations call it a disease, but yet it's
not being
we're not calling a spade a spade, Anyway.
So I'm seeing threaded through our conversation how you're leveraging your personal and lived experience into something systemic, like changing a policy or a workplace standard. How do you do that without losing what makes your lived experience powerful in the first place? Like, how do you find that balance of infusing your personal experience into the sort of recommendations you're making and what you're trying to affect, but also not losing the essence of the lived experience in the process?
Wow, that's a good question and a tough question. So I think the lived experience is always going to be there. That whatever it takes to get you to where, like, if we are trying to eliminate stigma, which was a big part of my lived experience. I don't know. I just think it's so much of my lived experience. If I could change things, would go away. So I don't know that I want to keep that. I don't know.
How did you experience stigma when you were First Lady and you started talking openly about this?
Yeah. Oh, so I was in recovery for 15 years at that point, and I never talked about it. Nobody knew. I knew people for 10 years, and they had no idea because of the stigma. So it was the height of the opioid crisis. 5 minutes before my first interview with a newspaper, I decided to talk about it.
Oh, wow.
I told my husband, and he was like, maybe you could have given me a little bit more notice. But anyway, it was like 1,000-pound weight got lifted off my shoulders when I started talking about it. I had no shame after that. I was like, I did it because I thought if I could help one person, because, when that stigma and that, suffering, and then it was like the first thing I did was, I think, a TED talk after the newspaper, and was shortly around there. I can't remember. And, people just were reaching out saying, thank you. But so for me, I didn't have the shame anymore after that. It didn't have the stigma. I don't have it now.
It set you free. Talking about it set you free.
Yes, absolutely. Completely set me free. Mm-hmm.
Wow.
That's what it does.
So I have one more question for you.
Okay.
What's the one thing that you want people who are struggling with their drinking or their drug use, who haven't reached the point of asking for or accepting help, to know?
Mm-hmm. Well, the one thing is that you have a disease. Reaching out for help is what people do when they have a disease. And the sooner you do, the better your life will be. So just know that you have a disease, and there's nothing to be ashamed of because you have a disease.
Beautifully said. Kathryn, I want to thank you for spending this time with me today and sharing not only your
work around the Great American Recovery Initiative and all that you're doing to work towards a change in our society and our healthcare system surrounding addiction, but also for sharing your personal story with me, your personal passions, and really kind of going there with me around what matters to you most and how this illness has impacted you personally, both on the kind of despairing side of it and emerging on the other side of it, where you've seen so much personal and professional success. It's been a real honor to talk to you.
Well, thank you. And thank you so much for, really bringing this topic to light for a lot of people and really making it available for people to learn more. The work you're doing is so important. So thank you.
Likewise.